Hello, you're welcome to my channel. I am Dr. Sandra. I am a medical doctor and a surgeon. Those of you that are new to this platform, you're welcome to my channel. I usually create videos and post on this platform to create some semblance of patient education by creating awareness and sensitization within my patients and the general population, especially about the different surgical conditions. This channel was my idea after an observation that patients lack the knowledge, the necessary knowledge, they lack the proper knowledge about the different surgical conditions. And the patients are also unaware of the implications, especially the negative implications of their signs and symptoms as well as their conditions. This lack of awareness in our patients and the general population usually portrays itself in form of complacency and a delay to seek surgical or medical intervention. And the bad thing about this lack of awareness is that the patients usually come to the hospital when their condition has worsened, it has complicated, their signs and symptoms are more severe. And for example, someone who would have benefited from a very simple surgery ends up warranting a much more extensive, bigger surgery. One of the examples that I've seen in practice is a patient that presented with an inguinal swelling, but they did not seek medical attention. And if they thought about coming to the hospital, if they had the right information that they need to come to the hospital on time, so that this inguinal swelling is diagnosed as a hernia, we would have just maybe done a herniorrhaphy. The patient would have just had a simple herniorrhaphy and the condition is gone, especially if there were no underlying causes. However, because of this lack of awareness and lack of knowledge, the patient now presents later on in life, years from when the signs and symptoms set in. So they usually present years when now they have complications, the swelling is painful, it is tender to touch, the patient is not even passing stool, the contents of the hernia are now gangrenous, and the patient now will require a resection and an anastomosis. So you see they are losing part of their gut because now the gut, the intestine is rotten, it is gangrenous, so it needs to be resected away. Sometimes they are not even fit for resection and anastomosis. They end up needing a bigger surgery. For example, they could need a stoma placement. And some of these surgeries are life-altering, they are uncomfortable to have. And this could have actually been avoided 10 years ago if the patient had the right information. So that is why I'm here. I want to bridge that gap, the knowledge gap, within our patients and the general population. So that is what I am all about on this channel. I am all about sensitization, sensitizing the general population and sensitizing my patients about the different surgical conditions. Today's video is about ulcers. I have made 2 videos in the past. It was about wounds and then stages of wound healing, the scars, the abnormal scars, keloid and hypertrophic scars. But now, today's video is my 3rd video and it is about ulcers. I am going to talk about the definition of ulcers, causes of ulcers, how do we investigate ulcers, how do we manage ulcers, what are the warning signs that you as a patient should look out for in case you have an ulcer. I'm also going to talk about why isn't your ulcer healing, why is it chronic, why is there chronicity within your ulcer, and also empower you with knowledge that can actually help you speed up the healing process of your ulcer. So let's start with the definition of ulcer. What is an ulcer? An ulcer is a break in the continuity of the covering epithelium, and this covering epithelium can be skin or mucous membrane. And this break in the continuity within this epithelium is usually, though not always, due to an internal disturbance, an internal disorder within this patient. And this internal disturbance, this internal disorder can actually result to molecular death within this area where the ulcer is occurring. Molecular death usually refers to death of cells, death of tissues, and even the biomolecules within that cell, within those tissues. The biomolecules include the nucleic acids, the carbohydrates, the proteins, and the lipids that are actually sustaining that cell to survive. So even those biomolecules die off, they cease function, there's cessation of the functioning of the biomolecules and the cell itself, and also the tissues which are formed by those cells. It also has to do with the longevity, the time frame during which this lesion called the ulcer is occurring. Usually ulcers tend to exist longer. They tend to take longer to heal. For example, a normal wound would heal within maybe six weeks. Most of the wounds are healed by 6 weeks. But ulcers, they tend to escalate. They tend to take a longer time to heal. They could even, the acute ones usually take about 12 weeks, but the chronic ones even exceed the 12 weeks. They can even go on for months and years. So that is actually the difference between the wound and the ulcer. It is all about the longevity, the time frame during which they are in existence, and also the etiology. Most of the time, these ulcers are actually due to an internal disorder, an internal derangement within this person, within this patient. That is why they occur. So let's talk about the causes. What are the causes of ulcers? Ulcers can occur as a result of infectious causes. It can be that maybe the patient has syphilis, the patient has tuberculosis, maybe they have actinomycosis. Actinomycosis is when you get infected by a gram-positive anaerobe. It's a bacteria. It is called actinomyces. And then you can get an ulcer out of that infection. You can as well get what we call Melanis synergistic gangrene, which usually actually happens after an abdominal surgery. It is caused by the streptococcus and then the staphylococci species of bacteria. You can as well have a tropical ulcer. So you can see that within the infectious causes, a given bacteria invades your body, and then you just end up with an ulcer. We also have what we call the neoplastic causes. The neoplastic causes are usually cancerous causes. It can be a basal cell carcinoma, it can be a squamous cell carcinoma, a melanoma, which can actually ulcerate to form this ulcer. These are all skin cancers that usually ulcerate and then they form an ulcer. The other cause can be a vascular cause. It can be maybe you have an arterial disorder. For example, you have atherosclerosis, where you have deposition of fat plaques within the walls of an artery. You can also have maybe what we call thromboangiitis obliterans, where you have inflammation of maybe your small to medium blood vessels, and you can still end up with an ulcer, an arterial ulcer. You can also have the venous causes, the venous ulcers. For example, you have varicose veins, you have DVT, that is deep vein thrombosis. You can also have inflammation of the veins themselves. So if you have any anomalies within your veins, you can still end up with an ulcer. The other causes can be traumatic causes which are actually traumatic in origin. For example, you can maybe have a mechanical injury, a physical injury, a chemical injury, and then you end up with a traumatic ulcer. Yeah, so you can see that actually there are some within you, there are some derangements that can happen, and then you can end up with these ulcers. Sometimes you might even be having metabolic derangements. For example, you have diabetes mellitus, and then you can just end up with a diabetic ulcer. So usually we have something ongoing, and that is why I argue that when you have an ulcer, you have an ulcer, or let me say a wound which is not healing, because in the layman's language, most of the time they call the ulcers wounds. But if you have an ulcer and it is not healing, usually it is because there is something ongoing, something internal that has been deranged, and you need to actually be investigated to find out what that really is, so that it can be managed and your ulcer can actually be also taken care of, and then you get better. You heal very fast when the cause has been established and it is managed. Yeah, so that is about the causes. Now, how do we investigate ulcers? We investigate ulcers by doing a discharge study where we swab away part of the pus or part of the discharge from the ulcer itself. We usually do ZN test, looking out for signs of tuberculosis within that discharge. We do cytology, looking out for how are the cells within this discharge. Are they malignant cells or are they benign cells? We also do gram staining. We do culture and sensitivity. Culture and sensitivity is also very good because it directs us to which antibiotics to use in such a patient. That is about the discharge study. And sometimes we also do what we call the edge biopsy. Most of the time we do what we call the edge biopsy. Edge biopsy is a tissue taken from the edge of your ulcer. Because we know that at the edge of the ulcer, that is where we have multiplication of the cells, maximum multiplication of the cells, multiplication and proliferation of the cells. So when we take a sample from this edge, we can easily have a picture of what is going on. So if you have a malignancy, you have a cancer going on, it can easily be captured when we take an edge biopsy. There is an area on your ulcer where it is called an edge, the edge of the ulcer, where we take that tissue for histopathology. The other thing that we do is we also do an x-ray of that area. For example, you have an ulcer on your forearm. We take an x-ray of the forearm to make sure that you don't have any underlying bone infections, because bone infections also have a way of derailing wound healing. And if you have a bone infection, you might also need another surgery called a sequestrectomy. So we always have to make sure that you don't have any underlying bone infection that might actually derail our wound healing, derail our ulcer healing, and might also need attention surgically. So we also do an x-ray of that area. The other thing that we do is we do random blood sugars, because I've told you can have metabolic causes like diabetes mellitus. We also do Dopplers. We do arterial and venous Dopplers to make sure that you don't have any clots within your arteries, you don't have any clots within your veins. We also do what we call angiograms to make sure that your arteries are not stenosed. And we also do what we call the venograms to make sure that you don't have any stenosis or any obliteration of the veins. So that is what we do. The other thing that we can do is a chest x-ray, because remember, one of the causes of ulcers can be tuberculosis. So we are looking out for the primary source, and sometimes it can be tuberculosis, which can be captured on an X-ray. So we do a chest X-ray as well, and we also do what we call a Mantox test. Still, it is for tuberculosis. We can as well do a gene expert and a ZN, like I've told you. If you're coughing, we can do a ZN on the sputum. So that is about the investigations. Now, how do we manage ulcers? Ulcers are managed meticulously by treating the underlying cause. If the underlying cause is not treated, it is not established, your ulcer is not going to heal most likely. It will not heal. It's going to be very, very chronic, and it might not heal on time. So I recommend we find out the cause of these ulcers. So when you come to the hospital, we usually establish the cause of the ulcer, we treat it. The other thing that we do is we correct any derangements. For example, you are severely anemic, HB maybe is about less than 6. We usually have to transfuse you. The other thing can actually be done by you as the patient. You can boost your nutritional status by eating food that are plenty in vitamin C, plenty in protein, plenty in iron, copper, zinc, and all the other macro and micromolecules, so that your nutritional status is boosted. The other thing that we do is we usually give you antibiotics, especially this antibiotic is usually directed and engineered by the results of the culture and sensitivity. So we usually give you IV antibiotics or oral antibiotics depending on how severe or how contaminated your ulcer is. We also give you analgesia because most of the time these ulcers are very painful, and we continue doing this for a long time, especially after we have also done debridement. We also do something surgical. We do debridement. Debridement includes excising all the devitalized tissues, all the slough, all the necrotic tissue are all excised away, so that the ulcer is now bleeding, so that we create an environment for the granulation tissue to form. And after doing debridement, we do what we call daily ulcer cleaning with antiseptic agents, and after cleaning, we do what we call ulcer dressing. We dress you with a sterile dressing. I am so in love with dressing because dressing is very protective. It protects you a lot. It protects you from infection, and it soothes the tissues. It protects it from dehydration. So dressing is very good. So we continue dressing this wound. Depending on the level of contamination, we can do it once a day or twice a day. Yeah, so that is what we do. And we continue dressing the wound. We continue giving you antibiotics until the granulation tissue, which is healthy and vibrant, has formed. And after the granulation tissue has formed, we go on to do what we call secondary closure. If the edges of the ulcer are so near, or we do what we call skin grafting or skin flaps if the edges of the ulcer are wide apart and they cannot easily be closed without causing stasis of blood. So that is what we do in the management. Now I want to talk about the warning signs. What are the warning signs that you should look out for when you have an ulcer? Always look out for chronicity. For example, this ulcer is not healing even after 12 weeks. If it is not healing, most likely there's something underlying that has not yet been established. For example, you have a malignancy, you have an arterial disorder which has not yet been established, or even the underlying bone has a problem. So you have to really be vigilant, because this is a warning sign. The chronicity, it is taking longer to heal. That is a problem. The other warning sign is this ulcer is in existence, but it is growing in a way that it is forming beads around it, beads, like a bead. Okay, this is a pearl, but it is a beads forming around it, forming around the outline of the ulcer. That is also a very bad sign. It is a bad sign because it is indicative that there is a possibility that this ulcer can actually be a malignant ulcer called the basal cell carcinoma. So if you're seeing your ulcer has some beads forming around it, that is not a good sign. It is growing in a way that it is forming some small masses around it, and these small masses are in form of beads that are clustered together around that ulcer. It is a very bad sign. If you're seeing that sign, it's a very bad sign. Please come to the hospital. We do an edge biopsy to make sure that we establish presence or absence of a malignancy. The other thing that should ring a bell is you have an ulcer, but this ulcer is growing in a way that it is spilling over the normal skin. That is a very bad sign that this ulcer is having some cells that are growing very, very fast and now are encroaching onto the normal skin. That is a very bad sign. It is a sign of a squamous cell carcinoma, which is also one of the skin cancers. So I urge you to also come very fast to the hospital. We establish if there is any malignancy within that ulcer. So we do the necessary intervention so that you're saved on time. The other thing that you should look out for is enlargement of lymph nodes, especially on the side where that ulcer is occurring. When the lymph nodes are enlarged, it is most likely due to malignancy. It can sometimes be because of infection, but most of the time it is because of malignancy, especially if the lymph nodes are not painful, they are very hard, and they are also adherent to the skin and the underlying tissues. That is a very bad sign. I urge you to bring the patient to the hospitals on time if you see such an occurrence, such a warning sign. It is a warning sign, it is a red flag. So I urge you to bring the patients on time. The other warning sign is you have paralysis, you have paresthesias on that side of the ulcer. That shows that maybe the nerves have been encroached upon by that ulcer. So that is a very bad sign. It is a sign that you actually have a malignancy most of the time. The other warning sign can be that maybe you're seeing that the extremities are getting dark. They are becoming purplish, bluish. Most of the time, the blood vessels have been occluded severely, that there is no blood that reaches the extremities to nourish the extremities, the toes, maybe even the fingers. So I urge you that when you see such a sign, you bring the patient to the hospital, because most of the time these patients are prone to getting septic. And what we usually do in such patients, we do disarticulation of the gangrenous toes or amputation of that foot or of that leg, so that we can save the patient. So you can see that you can always come to the hospital on time, because now you see, if you didn't come to the hospital on time, you end up with a life-changing operation where you have to adjust to living without a limb, living without a foot. So I urge you to really be so vigilant, be so adherent to your medication. If your doctor has come up with a given regimen that can help you stabilize maybe your blood sugars, your blood pressures, please be adherent to your medications, because it is for your own good that your sugar levels are well monitored, well managed, and are within normal ranges, so that you don't end up with such things. Especially if your sugar levels are to the roof, your blood pressures are also all over the place, you need to really be adherent to your medications. And of course, if you have seen such an ulcer that is causing such complications, please bring this patient to the hospital, because even though we are to amputate the patient's foot or leg, at least we can save them from sepsis that can arise from the gangrene of the foot or of the leg. Yeah, so that is one of the warning signs. And the other warning sign can be you have an ulcer, but this ulcer looks as if someone came and scooped part of your tissue and took it away. That is a very bad sign. It is a sign that maybe your arteries have a problem or you have syphilis. So it is a very bad sign. Or maybe you're someone who is bedridden, or you're taking care of someone who is bedridden and they are getting what we call pressure sores. So that is also a bad sign. That should also be ringing a bell if it is actually seen in such a patient, and should be taken seriously. The other warning sign is you have an ulcer, but instead of the ulcer being open, like most of the ulcers are, this ulcer is healing in a way, or is existing in a way that, for example, if this space is the ulcer, its skin are hanging within the ulcer. It is also a very bad sign. It is a very bad sign because it can indicate that this patient actually has tuberculosis. And most of the time they are also in contact with other people, their loved ones. They can easily infect them with tuberculosis, and also their bodies are failing, especially the lungs could be having the primary source. They could be the primary source of the tuberculosis. And so this patient needs to actually be treated for their tuberculosis first, and then we manage the ulcer later. And then the patient will be very fine. Yeah, so that is a very, very bad sign. It is a very bad sign, yeah. So that is about the warning signs. If you look at the patient is wounded, if you look at the patient themselves and then you see those warning signs, please bring the patient to the hospital so that we can do something about their ulcers. Now, I want to talk about why are ulcers chronic? Why is it that you're having this ulcer, but it is ongoing, it has been there for years and years, months and months, and is not showing any signs of healing? One of the reasons, it could be that maybe your ulcer is malignant. That is one of the reasons. The other reason could be that maybe the bone underlying that ulcer is actually infected. That is actually why your ulcer is not healing. You have what we call osteomyelitis. That can also cause chronicity, which can be that your ulcer is not healing, that you have a bone infection. So in the event of you having a bone infection, we do what we call sequestrectomy, so that the ulcer can heal without reinfection from the infected bone. If you have a malignancy, we can also manage the malignancy so that your ulcer can heal. The other cause of chronicity is maybe you're malnourished. You're lacking the vitamin C, the different vitamins that are needed for ulcer healing. You're lacking the proteins, you're lacking the iron, you're lacking zinc, you're lacking copper, you're lacking all the macro and micro molecules that are actually needed in the healing process of this ulcer. So you also need to look at your own nutritional status so that these ulcers can heal very fast. The other reason could be that maybe you're anemic. So you need to also come to the hospital. We do the hemoglobin levels to make sure that your hemoglobin concentration is within normal range, so that if you're severely anemic, HB is less than 6 grams per deciliter, we usually transfuse you with blood, because ulcers also need blood to heal. Yeah, so we always have to make sure that we investigate your hemoglobin concentration. The other reason could be that maybe you're hypoxic. Hypoxia is a reduction in the concentration of oxygen within your blood, and it can be the reason why your ulcer is not healing. It can be because maybe you have anemia, or you're causing intentional hypoxia by smoking. So that means you have to abstain from smoking so that your ulcer can heal very fast. The other reason can be because maybe the place where the ulcer is edematous, it is swollen. And I recommend that when you see any signs of swelling around your ulcer, please always make sure that your extremity where the ulcer is, or your limb where the ulcer is always elevated, so that we can have a very good venous return. You can always put a pillow below your calf muscles so that the limb is actually elevated, so that we can easily have a very good venous return to the heart. And if you're seated still, you're in a sitting position, you can still get a chair and elevate your limb and put a pillow below your calf so that you can still enhance the venous return. The other reason could be that you have loss of sensation, that because you're lacking sensation, you could be causing trauma to this area when you're unaware. Because if you're lacking sensation, it is most likely that you'll have trauma in that area and you will not even feel that you have trauma to that area. So I urge you to adhere to your medications. For example, if the cause of loss of sensation has been established to be your diabetes, to be leprosy, or any other neuropathic conditions, please adhere to your medications so that the loss of sensation is actually reversed. Sometimes it is reversible when the treatment has been adhered to. The other reason could be that you actually have recurrent infection within your ulcer, and this can just be avoided by taking your antibiotics and also making sure that your ulcer is always closed with a sterile, clean dressing. The other thing could be that you're having recurrent trauma to your ulcer, and still this can be avoided by having your ulcer dressed. I am so in love with dressing. You see, it has a lot of importance it brings to the patient, that it protects your ulcer and it also prevents you from having recurrent infection, protects it from dehydration, protects it from recurrent trauma. There's a way to soothe the area of the ulcer, and that environment is going to be a very good environment for the formation of the granulation tissue, which is our overall goal, so that we can actually do the surgical interventions, that is secondary closure, flaps, and grafting, skin grafting. So that could be, you have to look at those points I've talked about. If you have any of those, most likely that is why your ulcer is not healing. Yeah. The other thing I want to talk about is, what can you as a patient do to make sure that you speed up the process of the healing of this ulcer? Number one, abstain from smoking, because like I've told you, smoking has a way of causing hypoxia. And remember, your ulcer needs oxygen to heal. The other reason could be, the other thing that you can do is to make sure that you prevent recurrent trauma to that area. Dressing can do that for you. Prevent recurrent infection within that ulcer. Dressing still can do that for you, and also adhering to your antibiotics. And the other thing you can do is to adhere to the treatment of the underlying cause. For example, you're someone who has diabetes and your doctor has recommended a given regimen which is actually stabilizing your blood sugars. Please adhere to that medication so that the sugar levels are kept within normal range, and then the ulcer can easily heal. Because remember, ulcers tend to come as a result of an internal disorder within that patient. So adhere to your medication that have been prescribed by your surgeons, by your doctors, that are meant to actually treat the underlying cause. The other thing that you can do is You have to make sure that you boost your nutritional status by eating plenty of vitamin C, plenty of iron, plenty of proteins, and all the other macro and micromolecules. It is the same thing like in wounds, ideally. Yeah, so the other thing that you can do is make sure that you rest, because lack of rest in that area also has a way of taking a toll on the wound healing or on the ulcer healing journey. Yeah, so you have to make sure that you rest that area. We shouldn't see you in the bush. We shouldn't see you in the garden, in the kraal, in the farm, taking care of your animals with your ulcer open, wide open. It is also a way of introducing infection. So make sure that you actually rest. You rest your body, rest that area, so that the ulcer can heal. And when you do those things, trust me, with our help, the surgical interventions that we do, you're going to really have a very good surgical outcome, and you're going to heal very fast. You will not have a chronic ulcer. Most of the time, you're going to really flourish after the ulcer has been taken care of. So that is what I had for you today. I have really had a very good time sharing these insights and opinions about ulcers with you. And I suggest and request you to share my videos. Please subscribe to my channel, like my videos, comment, share to all your loved ones, share to all your social media platforms, share to everyone you can share these videos to. And I'll see you in my next video. Bye.